Okay, so today my trusty partners in crime, Gabe and Alexis, have given me a show here to watch and to comment on. Now you guys know from in the past, I don't watch a lot of TV. This says Grey's Anatomy, and this is Derek's thought while in the ER on how to save a life. So let's get rolling here. Here we go.
Semi-truck, blunt force trauma to the head, chest, and abdomen. Persistent hypotension after 2 liters of saline. Pulse is ready at 130.
You're not dead. Just breathe.
Need 4 units of blood.
Scalp black. Probably multiple fractures.
Okay, so here we have Derek on the table. Scalp black, probably multiple fractures. He's telling himself just to breathe. Clearly Derek is a medical doctor here who's been injured, who's on the table, and now he's talking his way through this procedures and the things being done to him. So this is pretty interesting.
Try and hold still.
Try and hold still. That's what we tell patients all the time.
Positive loss of consciousness at the scene. He's poorly responsive. GCS 10.
What's your name, sir? Can you hear me?
Yes, I can hear you. Loss of verbal skills.
Okay, so they're asking him questions now, which is exactly what we do. The first thing we do, we start looking in people's eyes, assessing their airway, assessing their breathing, their circulation, kind of trying to get some sort of an idea of how seriously they're injured. What's funny is she's asking him questions at this point, but he's not really responding verbally. Just, you can hear his mental thoughts, but there's no verbal thoughts coming out. I'm sure that'll play out here to be important. Let's see.
Possible bleeding in the brain.
Pupils are equal and reactive.
Good sign. Still should get a CT.
He's got a flail chest in the right. I need a 36 French tube now. Sir, can you tell me your name?
Okay, so that's not right. That's not accurate. So first of all, she says, we have a flail chest on the right. Give me a 36 French tube. So she's called for a chest tube to put into his chest, and she said that this is for a flail chest. So the first thing here that always happens is we assess someone's airway first. Is it clear? Do they need to be intubated? She's already to the B part of the ABCs, which is breathing. A flail chest, by definition medically, is at least 3 rib fractures in 2 or more places. And when you break a rib in 2 places, it just kind of works uneven like this. It flops around. And that means your chest doesn't have any symmetric way of breathing. People with a flail chest are dramatically short of breath, and it absolutely is an emergency because they can't breathe. Their chest can't compress and make the lung function properly because the ribs are so broken. And Derek is laying here fairly calm. You don't see him breathing fast or rapidly. And now in this quick assessment she did of placing a stethoscope on him, she says flail chest. That's Hollywood. That's not accurate.
He's still hypotensive and tachycardic after 2 fluid boluses.
Could be bleeding in his chest. Hang 2 units of blood on the infuser. I need a trauma panel and x-ray and cross him for 4. And somebody page surgery again. Right away.
So that's pretty good. So they cross him for 4. What she's asking for is to be typed and cross-matched. That's for his type of blood, for 4 units of blood. The other doctor or the resident here has said that he's hypotensive and tachycardic, meaning his blood pressure is low, his heart is beating fast, so he's losing blood somewhere. She immediately says he's bleeding into his chest. Not so fast there. Again, probably a little Hollywood there. One of the more common areas to bleed actually is not into the chest, but into the abdomen. And the reason is that we have a liver that's a solid organ, we have a spleen that's a solid organ, and they're like water balloons. And in a major trauma, they get hit and they rupture, they tear, and they're very vascular. I mean, there's a great blood supply to those. So you bleed a lot. Most often in the abdomen, she immediately assumes chest. We'll see here.
Smart. I like her.
I'm sorry. This is gonna hurt, but we have to do it.
Putting in a chest tube here. You do cut with a scalpel right over the rib. You don't shove the scalpel in, Hollywood. That's wrong. You shove the chest tube in, not the scalpel.
I must have hurt. I'm sorry. Can you please tell me your name? Can you tell me anything?
At that point, she's still talking to him. He's still not responding. You have to be concerned at this point that he has a bleed into his head. It's switched off now here to another scene and other people kind of coming into the ER. But he still has been nonverbal this entire time. So I'm concerned in a case like this of significant head injury. We know there is significant chest injury. The abdomen hasn't been looked at yet. That could be the source of all of his bleeding, and somebody better pay attention to that. So at this point, he should have a couple large bore IVs in him. Blood that's typed and cross-matched should be hung at the bedside, and a lot more assessment should be going on. And that may be happening. She's out of the room. Okay, here we are back.
We don't know the extent of his head injury.
She's right. You don't.
Look at the ultrasound.
Yeah, I know.
He's bleeding into his belly. We don't have time for a CT.
arrogant.
Oh, here we go. So she says, we don't know the extent of his head injury. And Derek, the doctor here on the table who's been injured, says, that's right, you don't. He still has not verbalized. So we have to be very concerned here about a significant head injury, maybe some bleeding into the brain. There's some reason he's nonverbal. She's addressed the chest issue. And now the other doctor does an ultrasound and he says, ultrasound, free fluid in the abdomen. And we already talked about that. Likely some bleeding into his belly as well from some of those solid organs I talked about.
Because she's younger than you, and probably because she's a woman.
I just think that...
We don't have time for a CT. He needs to go straight to the OR.
You have this. Come on, don't back down.
But I don't think we have a handle on
GCS
this.
hasn't changed.
This part has some reality to it.
Wait, you can wait.
See spine, chest, and pelvis.
Okay, let me stop here. It's almost over. What's happened here is that it sounds like the more senior doctor comes in and says we need to get him to the OR. He's got free fluid in his abdomen, meaning he's bleeding internally. And the maybe the more junior doctor saying, hey, we need a CT scan of his head. Something's going on in his head. Both are right. And now they're arguing over what should happen. Should he go to the CT scan, have the CT scan done of his head to see if he's bleeding into his brain? Or should he go straight to the OR and go have surgery for his abdomen? The risk, of course, is that if you ignore the brain and there's bleeding there and he goes and gets his abdomen fixed, there could be so much pressure build up in his skull that you have fixed the bleeding, but he dies because he's brain dead from all the pressure within the skull that built up from a bleed. The other risk is you go and you CT scan his head, and while you're doing that, he's bleeding into his abdomen and he dies because you didn't address the area that's bleeding. This is a common kind of tension that happens in the emergency department and with seriously or severely trauma injured patients. And this is great because this is exactly what happens. For the years I was in the emergency department teaching residents as an attending at the university hospital, these are the kind of conversations we would have. Exactly this. And here's the answer. What happens in cases like this are, there's the ABCs, which is secure your airway first. Breathing, making sure the chest and everything is fine. The C is for circulation. Do they have blood pressure? Do they have pulse, heart rate? What is it? How are they maintaining? And there's actually a D that gets talked about and an E. The D is disability and it stands for like neurologic. Are they alert? Are they neurologically intact? And the E is for environment. Have you cut off all their clothes and exposed the rest of them to make sure that there are no open fractures or other injuries? Frequently get so focused on the head, so focused on the chest. Now they're focused on the abdomen that they forget another area like a femur fracture that could bleed a whole bunch. So that's the E part, the exposure. But the D, the disability, the neurologic aspect, the alert, oriented, intracranial status, what's going on there, that needs to be checked as well. So here's where the proper decision would be made. In this particular case, you would stop at this point and reassess your ABCs. And that C is the circulation. After they've started the blood, after they've put in the IVs, what's the blood pressure? What's the heart rate? If that has somewhat normalized, or if it's at least stable and he's not continuing to go down, the right thing would probably be to go CT his head, because you don't want him to die on the operating room table, as I said earlier, with his abdominal bleeding while he's bleeding into his brain. If, however, you started the IVs and you start transfusing the blood and you can't keep up with his blood pressure and his heart rate because he's clearly bleeding a lot, or if you have that ultrasound on his abdomen, sometimes you can literally see an area of blood flow where an organ is bleeding. You have to go to the OR, and you have to go to the OR now. And you just have to take the risk in that case and hope that any bleeding into the brain or into that area is not serious, it's not severe. In this particular case, his pupils were equal and reactive. He is opening and closing his eyes. He's moving his eyes about as if he's alert. He just has not verbally responded. So at this point, either doctor could be correct, and we need more information before we can determine that. Okay, well, I summarized what the right next path would be. That was the end of the scene. That was pretty cool. Makes me want to watch TV more. I don't watch much TV, but there was a lot about that was very realistic. I hope I was able to stop and show you some of the Hollywood aspects of that are not realistic and how we would actually handle it, and I enjoyed that. So nice job, Gabriel. Nice job, Alexis. You picked something that I enjoyed doing, and I hope you guys enjoyed watching it.